sometimes Social Security, when they say no, doesn't necessarily mean no, doesn't necessarily mean no at that particular time, and it just might not mean no forever. So let's talk about that. If you're new to my channel, my name is Ed Weir, former manager of the Social Security Administration. I ran the third busiest office in the country, taking hundreds of thousands of retirement disability survivors claims, and now in my semi-retirement, I'm helping y'all make sure you're getting everything you're entitled to. So if you're currently receiving benefits, make sure I've got over 600 videos. I'm doing a live Q&A. This is live. I'm going to talk about when no doesn't necessarily mean no. Should take about 10 minutes or so. And then I'm going to open it up for questions. So if you have any questions about all things Social Security, retirement, disability, survivor, spouse benefits, Medicare, Medicaid, make sure you put it down in chat and I will answer questions for about an hour. Make sure you subscribe and share. Too many people out there are not receiving benefits they're entitled to. Okay, let's go ahead and get started. As you can see, this is definitely a live. All right, so no does not always mean no. With any agency, particularly the Social Security Administration, if they ever deny your claim, and this has to be an official decision. So a lot of people go into the Social Security Administration and they ask a question if they're entitled to X, Y, or Z benefits. And here's how the offices are set up, and the phone, the 800-772-1213. It's the people at, used to call the front windows, but now in the old days, prior to about 5, 6, 7 years ago, you'd have the front windows and then you'd have a back office, and Social Security would call that front FEI, front end interviewing. And that's where the specialists, the retirement, disability, SSI, spouse benefits, surviving spouse benefits, that's where they work. So you could differentiate between, the generalists in the front windows and the experts that actually take the claim in the back. But now, because of safety reasons, they're all essentially front windows. So it's difficult to tell who you're talking to. So if you go in and you think you're entitled to something, spouse benefits, survivor benefits, whatever the case may be, and then the person at the front windows says, no, you're not, that is an unofficial decision. That's not a decision. So the first thing I would do is say, hey, are you a CS or a CSR? A CSR is a customer service representative. That's the front line, the generalists, the least paid, hardest working, in my estimation. But in terms of expertise, unfortunately not there. So say, well, thank you for your opinion, but I would like an official decision. I want to set up an appointment. I want to see a claim specialist in the back today, or whatever the case may be. And then a claim specialist will take your claim. So if you think you're entitled to divorce spouse benefits, surviving spouse benefits, retirement, disability, then you only get official decision until you get a letter essentially in the mail that says, no, you're not entitled to those benefits, because, there's certain limits. If you say, well, I was married to this person, but I was only married 9 years. No, you had to be married 10 years. That is obviously a denial. But if you file for disability, you file for independently entitled divorced spouse, which I'm telling people, please share this. So many people out there are not receiving divorced spouse benefits because they're sitting around waiting for their divorced spouse to file for benefits. And you do not. You're throwing money away when you do that. As long as your divorced spouse is 62, you can file for benefits, regardless if they filed or not. So I'm telling people that they're going to their local Social Security office, they're talking to the frontline generalists, and the generalists were telling people, no, you can't file until that person files, and they're going away. And they come back and say, Ed, you told me. And then I give them the reference number, the PALMS reference number, which is the policy manual that Social Security uses. They go back into the office and they get their money. So, but any official decision that you get, not just someone saying whatever, an official decision, a letter, you can appeal. So the first step in appeal is a reconsideration, SSA 561. So you request a reconsideration and say, I disagree with your decision. And then somebody else in that particular office reviews it and sees if the first person made a mistake, made the right decision. And If they deny your reconsideration, then the next step is an appeal through an administrative law judge, a hearing, which unfortunately takes forever. But these are your benefits, and for decades, it's important that you go through the process. And I've got videos explaining how to do the reconsideration. The reconsideration takes about 10 minutes to fill out the form. The appeal takes about 10 minutes to fill out the form. Pretty easy. Then you just have to, unfortunately, the waiting game, as we used to say in the Marine Corps, hurry up and wait. But you can do this in terms of disability, overpayments. They could deny you for survivor benefits or whatever the case may be. And you think, in terms of survivor benefits, spouse benefits, come back here and say, hey, Ed, this is what they told me. And I'll tell you whether yes, it's a correct decision. If it's not a correct decision, then you go back and I can provide you the references to take back in case you have an issue with that. So you have those type of appeal rights when they say no. Doesn't necessarily always mean no. You can appeal those. Another way is things change. So in this case, no does not always mean no forever. What we see happening is people go into Social Security. So this is particularly for spouse benefits, living spouse benefits, divorce spouse benefits, surviving spouse benefits. And or they call the 800 number and they say, hey, I am, I want to file for spouse benefits. And how it works is, okay, are you currently married to this person? Were you married to the divorce spouse? Were you married to the person for 10 years? Didn't have to be consecutive years. If you remarried the same person the following year after you divorce them, Social Security can add those two periods together as long as it's 10 years. Another exception, there's just too many exceptions. And if they say at that particular time, you're not entitled, what's happening is people think, that's it, I can never get benefits from that person again. Not necessarily, because remember, for spouse benefits, you can get up to 50%, but your benefit amount has to be less than half of their benefit amount. And remember, always don't look at your check. That's your MBA, your monthly benefit amount. You want to look at the PIA. That's how Social Security determines the 50%, the primary insurance amount, which is the benefit at your full retirement age. So they compare your PIA with your spouse's or your divorced spouse's PIA to see if it's less than half. But the issue is people do that 5 years ago and they were told, no, there's no more money. You can't get any more money. Well, maybe at that time, yes, but things have changed. Maybe that person started working more and paying more into Social Security and their PIA went up and now there is money left over there. Or what I see a lot happening is, again, living spouse, 50%. Surviving spouse, you can get up to 100%. So 5 years ago, you were not qualified, you were not entitled to benefits on that record, but since then that person has passed away and now it's 100%. There are way too many people out there that are just walking around needing that money and not getting it because they were told no. And things have changed. That person has now passed away and it's yes. So, and there's a lot of money out there that are just sitting around waiting for people. So please, if this doesn't apply with all my videos, I always say this, all my videos, you're saying, well, I don't care about this, doesn't apply to me. Please just don't think about yourself. Think about your relatives, your aunts, your uncles, the lady down the street that's struggling, and just, go over there and have a cup of coffee and say, hey, I'm having a hard time with Social Security. Weren't you married at one time? Oh yeah, I went in there 5 years ago and they said I'm not entitled. Hasn't he passed away? There you go. Now you are going to be a hero because you're going to find money for people that really, really need it. Another Social Security, really, the employees need to do a better job at this. When you file for disability, Social Security, what they do is what we used to call it, what they still call it, I'm retired now, so I don't call it that anymore, addressed both programs. Social Security disability, there's two programs. There's SSDI and SSI. SSI is the welfare-based program, supplemental security income. SSDI is Social Security disability insurance, the one, your insurance that you actually paid FICA taxes for and everything. And when you file for disability, they look at both programs. And If your benefit amount is over this year $943 for a regular Social Security disability, you've got other income and resources, you're married, your spouse works, whatever the case may be, you're not entitled to the welfare part of it. So they send you a letter. You file for disability, you go in there and file for disability, and then a week later you receive a letter that says your application was denied. And what the Social Security employee should do, they should make you aware of that. They should say, but Social Security is at a 27-year low staffing, so they're having a difficult time even keeping up nowadays. What they should say is, hey, you're going to receive a letter in about a week, and it's going to say you're denied. That's only for the SSI program, the welfare based program. You look on the top of the letter and it'll say supplemental security income. Don't worry about that. That's because you've got more than $2,000 in the bank. It's because your spouse works. It's because your benefit on SSDI is going to be over $943 or whatever the case may be. You're getting a pension, whatever. So don't worry about that. On the SSDI part, still moving forward, they're going to send that to the DDS, the Disability Decision Service, Determination Service that makes the medical determination. But in terms of SSI, you're going to receive a denial letter. You're not denied, you're denied just for that program. The other part is still moving forward. So people kind of freak out about that, and rightly so, because they're not told that they're going to get a denial letter on something so quickly. All right, so those are, I just wanted to do the quick one, 11 minutes. I didn't take too long. That no doesn't always mean no. You've got appeal rights. Things change, and you were not entitled last year, 5 years from now, but that might change. In your particular situation, make sure you join my live Q&A. And speaking of live Q&A, let's go ahead and get started right now. Looks like I've already got some questions coming in. And Brenda, I have been learning a lot by tuning in. Thank you. You're welcome. Penny, what website do I use to file for Social Security disability? Thank you. SSA.gov, socialsecurity.gov. I recommend doing it online, disability, because again, Social Security short staffed, and they probably have 5, 10, 15 appointments that day, and a lot of office only allocate about 45 minutes to an hour for a disability claim until they schedule another one and another one, another one. And it's kind of it's unfortunate. So rather than feel all the pressure there, do it online if you can. If not, then schedule a phone appointment or an office appointment, and set up get all your prescription bottles, get the names of your doctors and when you saw them and all this other kind of stuff. Get yourself a cup of coffee, and then take your time and do the disability application at your own pace. Make sure you add everything in there. I did 3 or 4 videos on filing for disability. Watch those. There's a bunch of tips, tricks, and secrets on medical records, and whether you need the doctor's addresses, and a bunch of different tips and tricks. So, and file. The sooner you file, the sooner the process can start. It's taking anywhere from 6 to 9 months if you're lucky to get a decision on your request. So please file immediately, if not sooner. Dr. Weir, I got a letter from the Cobra people when I lost my work insurance by retiring early. It went from $89 to $524 a month with the Cobra plan. Would Obamacare be cheaper? Usually Obamacare, the Affordable Care Act marketplace, is quite a bit cheaper. Cobra, yeah, it was a good law. The idea of it was a good law that they would continue your health insurance after you work, but now the insurance company doesn't have to pay their portion. So that's why it goes from 89 to 524. And yeah, I don't know many people that can afford Cobra. So I would definitely check out the Affordable Care Act. Make sure I've put a team together. I've got a team that helps with, let me go ahead and put up the link here. I've got a team because I saw so many bad actors, people not doing the right thing. So I put together a team that can help with Medicare, the Affordable Care Act, burial insurance, because $255 from Social Security just doesn't do it. So just click on the link there, and I'll have somebody reach out to you and give you all your options. 100% free service, obviously. Let's see. Question: confused by a chart you displayed about taking early retirement mid-year. Chart suggests continue to receive monthly benefit plus wages over every month after. Can you go through this slow one? Yeah, I can. Yeah, let's talk about it right there. This is an important thing I should talk about on a continuing. I probably about 50% of my videos talk about this during live Q&A, but very important, and a lot of people miss it. So um, we're talking about early retirement. Once you hit your full retirement age, work doesn't matter anymore, so it's not an issue. But 62, 63, 64, 65, whatever, that's early retirement. So if you file at the middle of the year, say it's July, August, you want your benefits to start in August. The first year, Social Security can use a monthly earnings limit. So you're going to start your benefits in August. So Social Security doesn't care what you made before then. From January to July, you can make $1 billion. And then in August, you can collect your Social Security benefits and nothing is withheld and you're all good. As long as in August, you're not making any money or you're staying under $1,860. And what is $1,860? It's $22,320 divided by 12. So it's the annual limit divided by the 12 months. So as the first month you're under $1,860, you can start your benefits and continue to get your benefits as long as you're under the 1860 for the rest of the year. Next year, the following year, they can't do the monthly. You can only do that monthly basically only once. So next year, it's the annual. So whatever it is going to be in 2025, 23, 24,000 or so. You have to stay under that. Anything over that, they withhold $1 for every $2 you go over. So if you go $10,000 over next year, then you owe the Social Security Administration $5,000. So that's that. Adela, I am 62 and my husband is 67 in Social Security benefits. If I can file an auxiliary spouse benefit, does it affect his monthly benefits? No. Also, if we move overseas, can we drop Part B? Yes. Yeah, no. If you take, I got to stop saying it. Yeah, no. Yes, I am agreeing that I said no. I confuse people when I say that. I apologize. But you taking benefits from a spouse, surviving spouse is not an issue, but a divorced spouse doesn't affect their benefits at all. That's another way people are losing benefits. They were married to someone for 10 years and they, again, think that that person has to have filed for benefits, which is not correct. Or they think that them taking benefits will affect their benefits and their new family and their new kids, which it won't. Or they think that another way people are losing money here is they have a divorce decree, and in the divorce decree it said you can't get my Social Security, which is worthless. Social Security doesn't care about that. It has no effect. You can get benefits regardless of what your divorce decree says. Another outside of private pension, that's completely different. But in terms of Social Security benefits, divorce decree saying that you can't get it, no relevance. So no, it does not affect that person's benefit amount. Also, if you move overseas, can you drop Part B? Yes, you can. But I caution, I get this all the time. People say, I'm going to be living overseas, so I don't need to pay the $174.70. And it's just a waste of money. I'm going to be over there forever. And then a couple of years later, something happens, a political situation changes, they get sick, they get homesick, or whatever the case may be, and then they have to come back to the United States. And if they come back because they're sick, then you don't have Part B, and you're going to have to pay all of that out of your pocket. And you can't sign up for Part B until the general enrollment period, January, February, March. So inevitably, people get sick in July, and they have to wait 6 or 7 months for their Part B to start. And then they're penalized 10% for every 12 months they did not have health insurance. And that penalty is forever. Can I claim both survivor benefits from my husband and my Social Security? Yes, I am 62, widowed, was married 42 years. Yes, you can. I probably wouldn't, or I At the same time, you would sequentially, what I mean is, if you're 62, you could have collected survivor benefits at 60. You're still limited the amount of money you can make, $22,320. There's still that annual earnings limit. But yeah, if you're 62, you can collect survivor benefits and start collecting survivor benefits, and don't touch yours. Let yours continue to increase. And then hopefully one day, once you hit your full retirement age or 70, you get those delayed retirement credits, your benefit will be more than your spouse benefits. And then you just jump over to your own benefits. So you don't do your own first and then jump to survivor necessarily, because, if you're working, and so, the survivor doesn't get delayed retirement credits, because obviously they're deceased. So I would check out those two numbers. I would call Social Security immediately, if not sooner, and say, "Hey, I want to file for a survivor claim." And then you know, go in there, or on the phone, and you say, "Okay, how much is a survivor claim if I start this month?" And then you say, "How much is the retirement benefits if I start my own record this month?" And then you say, "Okay, how much is if I wait on my own until my full retirement age?" And then you can kind of compare those two and kind of figure out whether you want to do the survivor benefits first, or if yours is already more than the survivor benefits. But yeah, it really depends on where there's more money there. But don't touch yours if you get the survivor benefit. Sometimes it pays to go ahead and get survivor benefits, even if it's lower. Like yours is, 1,500 and survivor is 1,200. And you're like, well, yeah, this is more. But you're 62. This one is going to get even higher. So it might be better to go ahead and get the lower amount for a while. So this one keeps going up to 16, 17, 1,800 and then jumping over. So there's an option there as well. Does it affect the other spouse's income if the divorced spouse files prior to the other filing? Nope, nope. So I already answered it. I knew you were going to ask that question. So, yeah, that's again why people don't file those divorce, because they think it's going to affect them and their children, or whatever the case may be, or they think that the other person, the divorced spouse, will know. No, if you don't want Social Security to, if you don't want your spouse, your divorced spouse, to know that you're filing for benefits on your record, Social Security is not going to tell them. Independently entitled divorced spouse, sometimes it's a little bit more difficult, because there's a couple of extra hoops you have to jump through. But if you tell Social Security that no, you just, for whatever reason, you don't want that person to know, then you can usually work around that. Donda, is this a question I am confused about survivor benefits. My husband passed in 2015. I'm about to be 61. He would have turned 62 this past June. Does the amount of the benefit change if I wait until I'm 62 or 67? Yes, because you are taking early benefits. Anytime you take early benefits, your benefits are reduced, whether it's spouse benefits or retirement on your own or surviving spouse benefits. And it also depends. Surviving spouse benefits are confusing, so you're not alone. It really depends on whether your deceased spouse was already taking benefits or not. If he took it really early, at as early as 62, 63, there's called a widow's limb. So what I would do is, the only way to know is to call Social Security and set up an appointment and say, "Hey, I want to go ahead and file for survivor benefits. If I start this month, how much is it going to be?" And then you say, "Okay, if I wait a year, how much is it going to be?" And then if they say, "Well, if you wait a year, it's going to be exactly the same amount," then get your money now. But if it's considerably larger, then say, "Okay, well, all right, thank you very much. I will talk to you next year." They're not going to pressure you to, start the money now. If they pressure you, then yeah, then please talk to a supervisor. Yeah, they shouldn't pressure you. They will be very happy that you say, "Oh, okay, all right, never mind." And that means they have an extra 5 minutes in their day to take care of their other 400 claims they have sitting on their desk. If you're receiving your full Social Security and you pass, will your wife be able to draw your full Social Security? Yeah, if you've waited until your full retirement age, then your surviving spouse, your wife, can collect 100% of your benefit if he or she waits until their full retirement age. Also, if you also receive 100% VA compensation, will she be able to receive DIC? Yeah, I don't know about VA stuff. Even though I'm a former Marine, I didn't work for the Veterans Administration. My husband will turn 65 in January, doesn't want to retire until 2027. Do we need to apply for Medicare this year sometime? It really depends. So your husband's going to be 65. So if he has health insurance from work and his employer has 20 or more employees, his current work or your current work, or if you're currently working and he has health insurance from your work, then that's good, as long as your employer has 20 or more employees. Then you do not have to sign up for Part A, Part B, or anything. You can wait until you stop receiving health insurance from current work, 5 years, 10 years, 20 years down the line, and no penalty whatsoever. Some people do go ahead and sign up for a Part A, the hospital. It's a zero premium. But if you're contributing to an HSA, a health savings account, then you have to stop that 6 months before you start your Part A. And why do some people do Part A when they already have health insurance from work? Well, if you look at your health insurance for work, sometimes the health insurance for work has like a $3,000 or $4,000 deductible if you go to the hospital. So people get Part A, so they save that deductible. Not all of it, but they save quite a bit of it. So at that time, again, I've got a network, nationwide network of Medicare insurance brokers that can help you out when you're ready, because you have to fill the gaps. Part A and Part B alone, just that doesn't get it. You need to get either a Medicare supplement plan or a Medicare Advantage plan. So my people can help you out. And again, it's a free service. Full disclosure, if you like what their options they give you and you enroll, those people support this channel. Well, thank you so much for your hard work. What do you about ERS Ticket to Work company that helps you go back to work for disabled people? Yeah, so there is Ticket to Work organizations that help you when you're on disability. Remember, you have the trial work period, for 9 months, not necessarily consecutive. You can work as much as you want and continue your Social Security. I did a few videos on receiving Social Security disability and working. But yeah, the Ticket to Work, your taxpayer money pays for that service to help people transition to work. So please use it. And then if you do, make sure, that they're supposed to help you, kind of coming up with a plan and maybe finding a job and making sure you're doing everything correctly. Yeah, and they don't charge anything. So reach out to them and see what type of assistance they can provide. And yeah, come on back here and tell us how it went. But again, I've got other videos on working, the trial work period and the EP, the extended period of eligibility, and all the rest of it. So, hi, Ed. If I file for spouse divorce and I get approved, will I have to start paying for my insurance on A and B now? If you are 65 years old and for some, you weren't insured on your own record, you can get Medicare from a divorced, deceased spouse. No problem at all. So if you're 65, then yes, if you're going to get money, that means that person was insured. So Part A, the premium Part A, there's zero premium for Part A. For Part B, then yes. Once you apply and you turn 65, Medicare will send you your package in the mail with your Medicare card and the Medicare and U book and all that kind of good stuff. So yes, and again, you will need to find a plan that covers all of the gaps of Part A and Part B. Only about a third of us watching right now have liked the video. Yes, please, everybody like the video. That's how we teach this stupid AI algorithm that people need to see this stuff and get the money they're entitled to. So please like and subscribe and all that kind of good stuff. If you do get spousal benefits on SSDI and you work part-time, does that figure into the amount you can earn? Only the work. So how much you're getting for disability doesn't count in there. How much you're getting from spouse benefits or divorced spouse benefits or surviving spouse benefits, that's unearned income. So the only thing that counts for, the trial work period and all that kind of good stuff is actual working or net income from self-employment. Can I collect off ex-husband, married 10 years, under divorce spouse benefits? And when I reach FRA, collect on mine. How does that work? No, because it sounds like your ex-husband is still alive and kicking. You can only pick one or two if you're filing for surviving spouse benefits. Divorced spouse, the divorced surviving spouse. Only a surviving widow, widower, it's all the same thing. But if that person is still alive and kicking, you have to file for benefits on your own record first, and then you can file for spouse or divorced spouse benefits. So only if that person is deceased can you collect surviving and not touch your own. Is there a minimum age for survivor benefits from a spouse that was on SSDI that died? 60 years old. You can start surviving spouse benefits at 60 years old, unless you are disabled. If you're disabled, it's called disabled widows benefits. And you can collect that from 50 to 60 years old. All right, let me see. Got some other questions. Once they say you approved for both programs, what does that mean? Okay, so I assume you mean both programs, the SSI and SSDI. So yes, some people can get SSI disability and SSDI disability. Basically what it is, if you're approved for disability, the medical part, they look at how much your SSDI is, your Social Security Disability Insurance. And let's say you're only going to get $500 because, it's determined by how much you actually paid into Social Security over your lifetime. So you're only going to get $500 and you don't have any other income or resources. So you can get SSI on top of that. SSI this year, the max is $943. So that's the max you're going to get. So basically you'll get $500 from SSDI and another $443 from SSI for a total of $943. So yes, you can get both. And if you're eligible for SSI, then I would definitely go down to the state Medicaid, social services, welfare, whatever they call it in your state, and apply for Medicaid. And if you get Medicare, then you can have Medicare and Medicaid. And if you have that, you're what's called dual eligible. You can get a Medicare Advantage dual eligible plan, which is what I recommend. You can't get a Medicare supplement. Those are what I recommend if you don't have dual eligible or a VA medical. But if you're Medicare, Medicaid, Medicare Advantage, a lot of other benefits, reach out to us and we can have someone reach out to you and go over all your options. Let's see, if my husband turns 65 but stays on my work insurance, does he have to get on Medicare? No, he does not. As long as your health insurance is through your current work and your employer has 20 or more employees, then don't waste the money. Too many people out there, oh, I was told I have to sign up for Medicare at 65. Yeah, you do. If you don't have health insurance from current work, yours or your spouse's, and employer over 20 and all that kind of good stuff. So many people are paying that money when they don't need it. I can't get my late husband's Social Security because I will get a teacher pension when I retire. I'm in Massachusetts. Yes, that's called the government pension offset, and 2/3 of your government pension that you did not pay into Social Security will offset what you receive. People that paid into Social Security, their one is offset from the other two. So sister and mom live together, both collect Social Security. Mom gets SSI. Can sister get SSI also at 65? Yeah, if again, the maximum you get on SSI is $943, and it's a welfare-based means tested program. So they'll have to look at the other income resources. And SSI you can get based on a disability or what is called aged SSI. So your sister is 65, so yes. Again, but if she is receiving retirement or whatever disability, and that benefit amount is essentially over $943, there's usually a $20 kind of give me there. But over that, then no SSI, unfortunately. But if she's getting under that, then yes. Let's see. Can I continue to collect survivor benefits if I move out of the United States? Yes, as long as you don't enjoy the sunny beaches of North Korea or Cuba, pretty much. But there's also, if you're a US citizen, there is a website on SSI. If you're a US citizen, you can live anywhere except for those two countries. If you are a green card holder, um, there is a website you can go on to, just Google payments abroad screening tool, and we'll ask you, it's a social security, tool, and you put in there, are you a US citizen? Are you going to move overseas? What country? Because there's agreements with different countries. But if you're a US citizen, you're most of the time you're good, as long as you stay away from those two countries. If you work time on SSDI, do you calculate earning weekly or monthly? Monthly. But you can also, a lot of people don't know, you can also do averaging. So sometimes, if you're part of this whole gig economy and your, earnings go up and down all year, and one month you're over and the other month you're way under, you can ask the Social Security to do a yearly averaging, and they will check the policy and see if it's applicable in your particular case. Military retired 2003, only volunteer work since 2003, aka Katrina. Should I work now for next 5 years to contribute further for Medicare, Social Security? I am 67 and have not signed up for anything. Wow. Yeah, I mean, every time you work and pay into Social Security, everybody is the same, whether you're 30 or 50 or 80 or 100 years old. The more you pay into Social Security, if it's one of your high 35 years, so if you're 90 years old and you're working, and this year is one of your high 35 years of earnings, when you do your taxes next year and you notify the IRS and the IRS notifies Social Security, then Social Security will automatically go in there and reduce. So the last 5 years, that's not how your benefits are calculated. Your benefits are calculated based on your high 35 years of earnings. So if you work for 5 years, but those 5 years are not one of your high years, then it won't affect your benefits. But if they are awarding your high years, they will affect your benefits. And if you're 67 and you haven't signed up for anything and you don't have, and you're not working and you're not receiving health insurance from work, then you're going to be penalized for Medicare because you didn't sign up. 10% for every 12-month period. You say, you're probably going to say, well, I can get the VA and I'm happy with the VA. But some people that are happy with the VA are happy with the VA medical system until they're not happy with the VA medical system. So they get Medicare, so that way they have a fallback position. But then your retort is, I don't want to pay the $174. Well, there's Medicare Advantage plans, depending on your area, that pay for part of that. It's called a Medicare Advantage Part B give back, and they're usually called honor plans or patriot plans because a lot of vets get those. That's why they get those names to them. So. You can reach out, click on the little link that says more help here. Click on the part that says one-on-one Medicare help, and then we can have someone that's licensed and contracted in your particular neck of the woods and go over all your options. Or if you've got a Medicare Advantage, you want to make sure you're in the best one for next year, click on the link there, one-on-one Medicare help. And there's a little option that you can click that says, hey, I'm good now, but put me on your list for October, and see if my plan is still going to be the best, because there's going to be massive changes for next year for Medicare Advantage plans. A lot of changes. So, what documents do you have to take to Social Security office to apply for survivor benefits? Number one is do not wait, file. Because the sooner you call Social Security, you're protected for that month. So if you say, well, I need a divorce decree, which you'll need a marriage certificate and a divorce decree probably. I'll wait until I get those. No, no, no. Because if you don't get those for 2 months, you just lost 2 months worth of benefits. Call Social Security immediately and then start getting the documents you think you might need, but you might not need them. You definitely don't need the divorce, or excuse me, you definitely don't need the death certificate if the person passed away in the United States. You might need the marriage certificate. You might need the divorce decree. Usually you do. Um, but it really depends on maybe your spouse put that information in there already when they filed. But they have to be originals too. Have to be the original, not the original from 1970. If you were married in, Clark County, then you call it Clark County and they send you the marriage certificate or the divorce decree. So that's considered the original with the, the raised seal or the red stamp and all that kind of good stuff. So, all right, let's see. Maggie, what's up, Maggie? My son is 38 years old in Minnesota, had filed several times to get SSI and SSD. I don't think he probably has a work history for 40 credits. All right. So in terms of SSDI, then yeah, that's not going to be able to get there. But SSI, you don't have to have 40 credits. So if he's filed several times, yeah, some people file several times, but they file the initial claim several times and they don't go through the appeals process. So make sure he watches the videos. Again, Social Security defines disability as the inability to work. So if he's working, then it's working in terms of SGA, substantial gainful activity. They're sure it's $1,550. If he's working, making over that, then Social Security says he's not disabled. Or that's Social Security's rules for disability. So if he's being recently denied for SSI, then make sure he files a request for reconsideration. Have someone go over it and double check. Gabriel, I'm 60 years old and had spine fusion surgery that is causing me problems. Could you tell me if this will fall under the blue book for SSDI? Yeah, it really depends. Yeah, the blue book. On that, if your disability keeps you from working, then file. Don't worry about whether it's written there in black and white, because there's a lot of things that are improved, not in black and white, because your condition might not be in there specifically as your doctor diagnosed it with whatever Latin words they use for your particular issue. But the medication you take makes you go to the bathroom 20 times a day. And nobody's going to hire you if you have to go to the bathroom 20 times a day or fall asleep at work or stuff like that. So it's a total package. So please, please, please file. My recent application says it's about 80% done. Wondering, will he get approved this time? Yeah, I talked about this yesterday in yesterday's live Q&A. I appreciate Social Security's attempt to, join the 18th century and put stuff like that on there. But it's just like when you're downloading something on your phone or your computer, it goes, 5%, 10%, and then 80%, and then back to 20%, or it sticks on 80% for a year. And so, yeah, so I would possibly don't call the Social Security Administration, because it's probably still at the state DDS agency. I would call them up. I'm sure by now you have the name of the examiner. And so I'd call them up and say, hey, just want to make sure everything is good. Have you all sent it back to the Social Security office? Because what happens once they make a decision, they send it back to the Social Security office, your local office where you took the claim, and they do the technical adjudication and whether it's denial. But sometimes along the way between DDS and your local Social Security office, quality assurance might grab it. They grab cases randomly and review it. And then, then that 80% completion is way out the window, unfortunately. Thank you for your advice you freely give. You're welcome. 2 questions. Do I need to pay a quarterly tax on SSDI lump sum payback? I don't do taxes. Will rental income remain passive? Yeah, I don't do taxes. But in terms of Social Security, quarterly tax on lump sum, yeah, again, that's tax. Rental income. All right, so rental income does not count against your Social Security disability. So Social Security, again, defines disability as inability to work. And if you just have passive income, rental out and stuff like that, 401ks and inheritance, you were a child actor, long ago and you're receiving royalties, that does not count against your SSDI in terms of, hey, you're making money, you're working. No, you're making money, but that's not work. That's passive, unearned income. Just Jeff. Hey, what's up, Just Jeff? Hope everything's doing great. Hit those likes. Yes, please. Jerry, follow up. So if my benefits are 1,700 and the cap is 1,860, I can earn 100. No. So you are no the okay. This was about the monthly earnings test, and your benefits don't count in there. So 1860 is um, earned income from your job. So the 1700 you receive from Social Security is not part of the 1860. That's completely separate. The 1860 is only work earned income from work or self-employment. Thank you. Keep up the good work. Watching every day. I appreciate it. I started Social Security at 62 to care for mom. This year, husband full retirement age. If he passes first, I was told by Social Security office would be 73% of husband, which is 3 times mine. Was just it really depends on a lot of variables. Those numbers, I wouldn't 100%. It depends who told you that. As part of the claims process, once you file a claim, then they can tell you a good number. But if it was just someone at the front window rattling off percentages and stuff, then yeah. Um, this year, husband full retirement age. It really depends on when he started his benefits and when you start your benefits. You can get anywhere from 71.5% up to 100%, depending on a lot of variables. Can I work 15 hours a week and not lose anything? It really depends what type of benefits you're talking about. You're talking about disability benefits and you're making $100 an hour, then no, you're going to be over. Spouse had ALS, so was getting disability. How does that affect survivor benefits? It doesn't. If your spouse passes away and your spouse was receiving disability, that's considered getting benefits at full retirement age. So there is no, it's a little bit easier. So if you wait until your full retirement age to collect surviving spouse benefits, then you get 100% of his benefit amount, which was his benefit at his full retirement age. If my ex draws any Social Security off me, will that hurt what I get? No, not at all. Vice versa is also the same. How would I be able to find out what his Social Security benefits are? So when he does pass away and I collect widow's benefits, I still wait. Yeah, then you would, on a divorced spouse, you would have to take your marriage certificate and divorce down there and show them that you're related. You're just not trying to get information on someone you don't know. Social Security needs some type of proof to give you that information, and they're kind of cagey about it because they don't want to give you, personal information. They'll look at your benefit record and his benefit record, and they'll kind of give you guesstimates. Nobody gets a final decision of how much you're going to receive until you actually take an application. I will apply for SSI very soon. I will be 65 on August. Do you have any suggestions that I can help me when I apply? Yeah, number one, you're not applying for SSI, I assume. SSI is the welfare-based program. Well, I mean, you could be very well SSI aged, but you're probably talking about just regular retirement benefits. So yeah, remember, 65 is not your full retirement age, so your benefits are going to be reduced. Your full retirement age is probably 65 or 66 and 8 months, or excuse me, 67 or 66 and 8 months or something. So it's going to be a reduction, but if you want to do it at 65, that's completely your decision. Nobody can tell you whether you should take it at 62 or 65 or 67 or 70. A lot of videos out there saying, you should do it at this time, but so many variables, your health and longevity in your family, whether you need the money, taxes, spouse benefits and all that. But one thing, you're 65, so that's definitely the time you need to sign up for Medicare if you don't have health insurance from work. So, and if you're going to sign up for Medicare, because you're hitting 65 and you're saying, no, I actually want to wait till I'm 67 for the money. No problem, whatever. Sign up for Medicare Part A, Part B, just Part A, whatever the case may be, depending on whether you have health insurance from work. And then just tell them at that time, says, no, just start my Medicare. Just start my Medicare Part A or start my Medicare Part A and Part B. But money, I'll come back next year or 2 years or 3 years from now and start the money. I just want Medicare to start. So you can do that as well. I will receive a small retirement from having worked for the state of California. One of the benefits, the state provided 100% medical without affect getting Medicare, Social Security. No, not for Social Security. That place might, you know, make you sign up for Medicare because they want to push costs over to the federal government. So I would definitely reach out to them and say, hey, I'm coming up on 65, and do y'all make me sign up for Medicare? And remember, though, if you don't sign up for Medicare because you have health insurance from, that retirement plan, if for some reason that ever stops, you're no longer happy with it, the pension plan goes bankrupt, whatever the case may be, then and 5-10 years from now you sign up for Medicare, then obviously you're going to get penalized for the rest of your life. But that's probably not going to happen in terms of going bankrupt there. So, but you never know. Safety reasons. Are they afraid people will get angry for not giving them benefits originally agreed to, or when they find out Medicare doesn't cover the most basic and essential health needs? Yeah, not sure. Well, I'm not happy about the fact that Medicare doesn't cover dental, vision, and hearing. It's like, come on, how healthy are you going to be, at 65 and beyond if you can't see, eat, or chew or hear? Yeah, yeah, but those are my personal opinions. I think Medicare should cover a lot more. So, but my opinion, and $8 will get you a coffee at Starbucks. Wife is on SSDI. We have been married over 10 years. I'm currently 55 and haven't been able to work in 8 years. Someone said I can claim half of her SSDI amount. Is this true? Yes, but not now. You have to wait till you're 62 years old. So you can, well, you probably can't file for benefits, disability benefits on your own record, because you have to also, for disability, you also have to be currently insured. You had to work 5 out of the last 10 years before you became disabled. So if you haven't worked in 8 years, then that sounds like it's going to be difficult, and if not impossible. But you can apply. It depends on how much she makes and your resources and income, for SSI, the welfare-based program. So definitely check that out. What is it called when you've been married for 10 years and you are divorced and want to file? Divorce spouse benefits. Unless your ex-spouse has not filed for benefits yet, but they are at least 62 years old, then it's called independently entitled divorced spouse benefits. It's a nice, that's a nice long name. And as I mentioned, people are going into the office, Social Security, their local Social Security office, and the people at the front windows are new or whatever the case may be, and they're giving out the wrong information. So there is the reference number. I just typed in the chat the reference number. So if you go in there and file for independently entitled divorce spouse, have that reference, and that way the person at the front windows, when they say X, Y, or Z, you hand them that, and then they will disappear for a time, 10 minutes, and then come back with a sheepish look on their face, and they say, "Oh, never knew that." And then you say, "You need better training, buddy." Okay, let me see. Ed, what percentage will I receive as a survivor ex-spouse if my husband is receiving full Social Security and I'm 62? That'll be reduced about 30% or so. So yeah, if he waited till his full retirement age, then yours will be about 71.5% or so. And every month you wait, your benefit amount increases. So I would call, set up an appointment, and kick around your options. Again, They're not going to force you to start your benefits. They're not used car salesmen like that. And they're not going to lose the sale. You call up and say, "Hey, I want to file for surviving spouse benefits. I wanted to get a definitive number so I know how to plan for my future." And then they will tell you how much your benefit will be this month. And then you say, "Okay, change the MOE, the month of entitlement, and your little MCS, the system, change it to next year, this time next year." And they'll change it. It takes about 2 seconds. And they'll tell you how much your benefit amount will be next year. And then at that time, you'll say, "Oh, next year sounds better to me. See you next year. Bye." And yeah, then they'll say bye. And again, go back to their desk with 400 folders on it. Let's see here. Most CalPERS members pay into Social Security and Medicare. Check your pay stubs or W-2. Um, uh, I've I've had a lot of CalPERS. They definitely pay Medicare. All the city, state, local entities, government entities throughout the country that do not play with Social Security, do not pay into Social Security, they pay the Medicare part of FICA, but they don't pay the Social Security part of FICA. They pay the 1.45% for Medicare, but not the 6.2% for Social Security. But yeah, I'm sure some of them, are a little bit different depending. Yeah, and then California does everything a little bit different. So sometimes they do it right, sometimes not so much. There is any money I can get, even I'm not divorced, because my 76-year-old husband make double of mine without hurting hit. Yeah, if you're divorced, okay, I'm not divorced, so yeah. So if you're currently married and your husband's benefit amount is more than twice yours, and again, don't look at your checks. It's the monthly benefit. It's the PIA, the primary insurance amount, and the only way you can know for sure is call Social Security, call the 800 number. It's still early in the day. Call them up today or tomorrow, and you and your husband there, and say, "Hey, I'm getting X amount of money. Here's my husband. Here's his information. Is there any more money there?" And they will be able to tell you in 2 seconds. And if there's more money, they will schedule an appointment for you, and then you get your money. Purple Love. Hi, Dr. Ed. Listening, learning. Awesome. Awesome. And hopefully sharing. That's the most important thing. We need to, a lot of people out there are hurting. So we need to share that information, but I know you are. Usually only sworn safety officers, CHIP officers, California firefighters are in separate safety tier, do not pay. Okay. CHIP officers. Yeah. Remember the old Eric Estrada? Yeah. I love that show. The earnings cap is 2320 in 2024. Are you limited to making 1860 a month? What happens if you exceed 1860 a month? Okay, yeah, the earnings cap is $22,320. And again, the 1860 is the first year that you start your benefits, the month you start your benefits, the 1860. So if you tell Social Security that you're going to make below 1860 for the rest of the year, and you make over 1860, then you're not entitled to those months of checks. But between you, me, and the wall, the computer system never catches those. But it's one of those things where it's like, as soon as you do it, it's like, well, I finally caught one. They've improved the algorithm, and they caught me. So just stay under the 1860. I'm 63. I will retire October 1st this year, getting about $2,000 pension and a $2,000 Social Security. I want to work part-time, moving near grandkids. How much can I make before taxed on Social Security? I don't do taxes. But in terms of, okay, if you mean the withholding, then yeah, $22,320. So the pension doesn't matter. Don't worry about that. The $2,000 you get from Social Security doesn't matter. The $100,000 you should get for taking care of the grandkids. Anyway, but yeah, if you work and you make over $22,320, then Social Security will hold back $1 for every $2 you go over. So, but again, Social Security, that doesn't figure into the 22,000. Your pension doesn't figure into it. What is call when you file? You are divorced, been married for 10 years. He is still working. What is call when you file? Yeah, I'm not sure about that. Let's see. We're getting close to the end. Let me go through here and see. Let me find people I don't recognize that are new to the channel. How do I go about signing up for my husband's Social Security? I am 68, he is 70. My retirement age was 67, but started taking mine Social Security at 65. I don't get very much, and he gets over 3,000. I can't figure out how to switch to his side. You don't switch, you just add. Yeah, you just call Social Security, and you can do it online. A spouse benefit. He is currently receiving benefits. You are currently receiving benefits. So if his benefit amount is over twice yours, your full benefit amount, your PIA, then yes, you are 100% entitled to those benefits. Call the 800 number and just say, hey, I want to take a spouse claim. I want to file for spouse benefits. And if there is, in fact, more money, which sounds like there is, they will set you up an appointment and they'll get you their money. Yeah. Saved your Social Security playlist on my channel. Awesome. Awesome. All right. Okay, let's see. Can you change your mind if you realize that you should have waited and returned the money? Yes, for the first 12 months. You can withdraw your application within 12 months, but you have to pay back all that money. Yes. Can I receive my deceased military husband's Medicare and VA medical insurance? Don't know about VA part of it, but yes, if you're not entitled to Medicare yourself and you're entitled to benefits from a deceased spouse, yes, you can. All right, let's see. La Lopez, first time I think I've seen you here. Ex-spouse of 10 plus years passed at 63. He was married. I am 61 and never married. Can I apply? Yes. And when? Now. He should get max benefit. Can I apply? And what is the percentage I might be entitled to? Ex-spouse and passed at 63. It really depends again whether he was started receiving benefits or not. But again, I would call immediately, if not sooner, because you could have started at 60. You're limited to the amount of money you can make in terms of earnings. So if you're currently not working or working and making, under $22,320, even if, if you're a little bit over, they'll withhold a little bit, but hey, extra money coming in. So call up Social Security immediately, schedule an appointment. The appointment won't be for a month or two because they're so backed up. And then they will tell you definitively how much your benefit amount is going to be. Nobody can tell you definitively until you actually file a claim, and they'll tell you how much. And then again, just say, okay, what if I wait a year? And then they'll tell you the benefit amount for next year, and then you can make your decision at that time whether you want to start it immediately or later. Wow, is it really that high for a cup of coffee? Let's see here. Can we walk into a Social Security office to make an appointment or only call in to get an appointment to ask questions? You can walk into a Social Security office and schedule an appointment. Yes. But if you only have questions, usually they don't do appointments for that. Most offices don't do appointments for that. They only do appointments for actual claims, because questions are answered by the front customer service representative. But if you actually want to take a claim, then you go back and talk to a specialist. And I know it's a terrible system, but or you can call the 800 number and schedule an appointment. But if you just have questions, then they're probably not going to set you up an appointment. How do we know if we're getting the best Medicare benefits possible? Is we even do not know what questions to ask. Yeah, find someone that you know and trust that is contracted. The best is to get a broker. All the people that I work with are brokers. That means they are licensed in your state and they are contracted with several different companies. So they don't have any skin in the game. They check your doctors and your prescriptions and what you need, dental, vision, your budget, whatever the case may be. And then they go out into the market in your area and look through all the dozens of plans available in your area. And then they come back and say, this one looks like the best, but this one is a good too. And this one's, if you want more dental, this one, whatever the case may be. So that's the best way to do it. And this October, you really need to do it in October. This is going to be a big year for changes. So click on the little link there, pick the option on Medicare, click the little option that says, hey, I'm good now, but put me on your list for October, and then we will compare and contrast what you got. All right, let's see here. Christopher, let's do, we're time's up. Let's do this last question. I am receiving Social Security SSC and working, paying into SSC. What is SSC? And will get a raise from paying. Yeah, not sure what SSC is. Social Security Children's Benefits, Child and Care, Disabled Adult Child Benefits. Yeah, I'm not sure. All right, so we are out of time. Sorry if I didn't get to your question. I will be back again tomorrow, as it seems like I have been every day for the past 100 days or so. So if I apologize if I missed your question, join me tomorrow and I will get it